It's a sign you don't often see these days in the Northern Territory.
How difficult is it to get a bulk billed appointment in the Northern Territory at the moment?
Well, you can't.
Would you even know where to go to get a fully bulk billed appointment these days?
No idea. I don't think there's many about, is there?
No, there aren't, and new data backs this up. Online GP tracker Cleanbill looked at 44 clinics across the NT and found as of January this year just 9.5% offer bulk billing to all patients. That's down 10% since the start of 2024, the steepest decline of all states and territories in the country. The average out-of-pocket cost to see a doctor in the NT is $43.86, up 7% from the year before. The NT now the fourth most expensive place to see a doctor in Australia, behind Tasmania, the ACT and New South Wales.
You've gone from having 1 in every 5 GP clinics across the territory bulk billing those adults to 1 in every 10, fewer than 1 in every 10.
For some, it's not just the cost.
I try and avoid doctors like the plague because it's never any good news once you get over 55.
The Australian Medical Association says a downturn in affordable healthcare is having a real impact on an already overburdened hospital system. Not only are more people turning to emergency departments like this one to avoid the cost of visiting a doctor, they're also leaving often serious medical issues unchecked, leading to longer stays in hospital later on.
And instead of having like a day or two admission, you end up spending a week in hospital. So it just adds to further pressure.
Dr Parker says efforts to increase Medicare rebates aren't having the desired impact.
GP practices are in essence businesses. You've got to pay staff, you've got to pay rent, practice costs.
The AMA says a possible solution could be establishing more urgent care clinics and providing extra funding for clinics who manage patients with chronic illness. Olivana Lathouris, ABC News.